Thank you, Member for Lyons. I call the honourable member for Indi.
Deputy Speaker, I'd like to bring to the attention of the House an amazing service that's operating in Northeast Victoria, auspiced by Northeast Health Wangaratta, and it's telehealth. So telehealth is the use of information and communication technology to offer rural and regional communities a real opportunity to reduce existing inequalities, to improve health services without having to travel. We've got this fantastic service now operating out of Wangaratta and right across Northeast Victoria. And today I'd like to acknowledge the leadership of the CEO of the Wangaratta Northeast Health Hospital, Marg Bennett, for her leadership. I'd like to congratulate Jane Keeley for the wonderful work Jane's done as project leader. And I'd also like to acknowledge the work of Dr John Elcott, who's the Director of Medical Services, and to also thank Dr Helen Haynes through the University of Melbourne, who has done the evaluation of this service. So what we have is in Wangaratta, through the use of technology and really high-grade telephone conferencing, we've linked up to health services in my rural communities of Rutherglen, Tallangatta, Corryong, Beechworth, Myrtleford, Bright, Mount Beauty, part of Alpine Health, Benalla, Mansfield, Alexandra, Yea and Eildon. And the service that's provided is through high-grade internet connections. We've got links to air ambulance for emergency retrieval of critically unwell patients, and they support GPs and nurses. We've got 24-hour access to mental health triage, preventing travel for patients and families and mental health workers. We've got hospital in the home for patient services. We've got high-risk foot services. We've got tele-rehabilitation. We've got residential care and many more services. But what I particularly like is the weekend coverage. So if you're in one of those rural communities, you link into your telehealth and you've got management of patients all weekend. So they get access to the Wangaratta, they get access to the specialists, and the nurses in the health service know that they've got the support of a fully fledged group of people. So what I really want to say to the House is telehealth is just beginning. It's got enormous capacity to grow the rural workforce. It's got enormous capacity to deliver healthcare services of all types. And telehealth care can reduce barriers. So in closing, I'd really like to acknowledge the foresight of Northeast Health Wangaratta. You're taking a leading role, you've done a fantastic service, and the best bit of all for me was when I was able to bring the Governor-General to Wangaratta in February this year and have him actually experience the connection with Corryong and see it working firsthand. Well done to all concerned, congratulations, and I look forward to working with you in the future on this really important service.